everybody, I'm Amanda Lambert.
And I'm Leslie Eckford. Welcome to Mindful Aging. And today we have a topic that we know that you want to talk about, but I have to say first, this is for adults only. So if you are under 60, you need to leave the room. Please let me introduce our guest, Monica Bell. She's a nurse practitioner, and she's been helping us a lot understand hormone replacement therapy, and that is really going to bring more life back to your sex life.
We're going to talk about sex,
Yay.
finally, intimacy. Oh, let's get started.
Great. Well, I love to talk about this, and I think it's really unfortunate that most primary care doctors or practitioners don't talk about it. We're not talking about intimacy because intimacy is so important. Intimacy is important because we live longer if we have good connections with our partners. We have better health. It's just a greater sense of well-being. So it's a really important topic, I think, that gets pushed over a lot.
And for older adults, it's almost taboo. You've lived your whole life.
Right.
You may have had children. You may have had many partners in your life, but don't talk about being sexually active as an older person because it makes everybody feel sick.
Well, not to mention that I think there's this unspoken acceptance that as you get older, your libido is just going to dive off the cliff, right?
Well, and it's not, it really happens.
Right.
Because we have.
But we accept it.
Exactly. And it's just what happens in menopause and in menopause, andropause, for men and women. I think for women, menopause is the vagina's kryptonite for its vaginal powers.
That's scary.
Ooh, that
It
is
is,
scary.
and the vagina is so powerful. It's so wonderful. Like, we just need to, why are we pushing that under the table? Why aren't we talking about it? So, but the menopause takes away the vagina's power to be lubricated. Dry and painful sex happens. It's just sad to hear a patient come in and say, I love my partner, I love my husband, but I don't want him to touch me.
Yes.
Because it's painful. It's patients will have vaginal bleeding during intimacy. It feels like I've heard shards of glass. It's terrible. So we really need good lubrication, and without hormones, the vagina is just very dry and will wither away.
But what about desire?
Yeah,
Maybe some women don't want to be touched because they don't have the desire.
Exactly, and that's true. We are chemical creatures. Without the chemicals, we cannot feel that drive to get the intimacy. So often women, you tell them if we start hormone therapy, you might get an increased desire. And they like, no thanks.
I'm not sure I have time in my schedule for that.
Right. But many women have come back and said, I feel alive again because I have that drive, and I didn't realize what I was missing. So intimacy is, it really does come back when you get those hormones back and you get the drive, and you might even find yourself initiating intimacy with your partner.
Oh, goodness.
I know.
Something just occurred to me, Monica. How old is too old?
That's a great question. In my practice, I say no one is too old for hormone therapy, especially when their quality of life is being affected with their not being able to have intimacy. Or also another vaginal superpower is to protect itself from bugs and bacteria and yeast infections. And without those hormones, your vaginal health is really not at its optimal level, and so you often can have repeat vaginal infections, bladder infections,
which is
yeast
the bane
infections.
of most older women's existence and men.
Yes.
As you hit a certain point, that can be the thing that does you in.
Right. Yeah.
Interesting. And I guess, there are some older women that are widowed or they don't have partners. And I guess it's still a good thing for vaginal health, and I guess there are dating apps for older people,
Yes,
so that
there
would
are.
work, right?
Yes.
I mean,
And I think it's surprising. There are, older people want to have sex.
yeah,
And it's good to have sex.
exactly.
Yeah.
We should be having sex.
Yes.
And so tell us about how hormone replacement therapy can help older men.
Yeah, so men, their hormone drop off is a little bit more controlled. So they fall off hormonally more gradual. So their signs aren't quite as noticeable as women in menopause, where we kind of fall off the cliff. Men, it's more gradual, and so they start feeling maybe lack of, vitality or lack of desire, and pretty soon they're okay with their wives hiding from them, so they don't have to have intimacy. They say, "Oh, okay."
Yeah.
Yeah.
I don't
Because I'm
need
kind of feeling the same way.
Right. So they start having a lack of desire. Their erections are not as strong and as high quality as they used to be.
Yeah.
They don't have fantasy or desire like they used to. And so often when you replace hormone therapy in men, they get better morning erections. They have higher quality erections, and more stamina.
Sounds like a win-win for the couples.
Yes, absolutely.
Yeah.
But it's nice to treat couples, because you don't want to make
One for the balance go off.
Yes, exactly. I always say you want to be balanced with your desire.
And as we're talking about this, I think, yes, we love to talk about sex, but part of the reason that we're all interested in sex is it is so much a part of our youth and our feeling youthful and alive.
Oh, that is so true, Leslie. I never thought about that. It's just like, and it's something that seems like, as I mentioned before, that we just accept. You get older and you kind of lose that part of your youth and vitality. And why should it be that way?
Yeah.
I mean,
it doesn't have to be.
Yeah.
Yeah.
Yeah, great point.
Well, thank you so much. This is a fantastic topic. We'd love to hear your questions. If you have questions for Monica, we will pass them along and bring her back and get that done. Thank you so much, and stay tuned for more for Mindful Aging.
Thanks, everybody.